This is IV insertion video for Lara Butler. First thing I'm going to do is check the order for my patient and gather my supplies. I'll bring 2 of everything, though I'll keep some of it out of sight in case there's any reason that I need to start again. And then I will go see my patient. And this is my patient, Mr. Bear. Good afternoon, Mr. Bear. My name is Lara Butler. I am a nursing student and I am here to insert your IV. Have you ever had an IV before? Oh, you have? Okay, so you're familiar with how it works. We'll go ahead and check your ID. Can you give me your name and your birth date? Thank you. That matches the record and the order. All right, so I'm going to go ahead and get my stuff set up here, and we will get going. Clean my hands again, and I'm going to get some gloves. All right, the first thing we're going to do is apply a tourniquet. This will be snug around your arm. I'm going to place it about 1 to 2 inches above the elbow, and I will pull it tight. Pinch and tuck. I'm going to have it nice and snug so that we can get a visual on your vein. Now I'm going to both visualize and palpate for a nice vein. And you appear to have a good one right there, Mr. Bear. So we're going to go ahead and release that for the moment. And I'm going to go ahead. I'll take my chlorhexidine wipe or what other cleaning product I have. I'll crack this and then I'll scrub the area. A good vigorous scrub for 30 seconds to a minute. While that dries, I'll go ahead and get the rest of my supplies set up. I'm going to go ahead and take my J-loop and I will attach the saline syringe to this J-loop. I will prime the tubing until it drips. I'm going to go ahead and remove the cap carefully from the J-loop and reinsert it back into the packaging to keep it nice and clean. Keep that close. All right, got my needle. Everything's ready. All right, that's dried now. So now I'm going to go ahead and reapply the tourniquet. All right. As we withdraw the needle, I'm going to verify that bevel is up and that the catheter is all the way back to the hub. All right, Mr. Bear, I'm going to hold here to stabilize the vein, and then I am going to insert bevel up at about a 15 to 20 degree angle. There'll be a little pinch, Mr. Bear, and I will insert until I see flash. Once I see flash, I'm going to advance the hub and the catheter. I'll withdraw my needle and put it in the sharps. And because there'll be blood coming out, I will attach my J-loop quickly. I'll release that. I'll get my bandage. We're going to place the bandage right up to the hub with the insertion site in the window. Now I realize that I skipped a step, so I'm going to tell you what I would have done. Before placing the bandage, I would have done a draw for blood return and then flush to make sure that the catheter is in place in the vein and that there was no infiltration or bubbling around it. Then I would go ahead and place the bandage, and then I will do the same thing again. I will check for blood return and then flush and look for any bubbling or infiltration and make sure that this flushes easily to ensure the catheter hasn't shifted from the vein. I'll then go ahead and take this off. Get a hold of it. And I will apply this across the hub to stabilize it further. I'm going to go ahead and clamp my tubing, and I will loop my J-loop, take a piece of tape. I would use a piece that doesn't have the green arrows on it still to secure the J-loop. On the tag, I would initial it and date and time when the IV was inserted. And that is, oh, I would also check and ask Mr. Bear, how did that feel? Are you all right? Any residual pain? Good. And I'll verify with my patient how they felt about the procedure. Then in my documentation, I would document the needle size and gauge, location of the insertion, date, time, how the patient responded, and if there was more than one attempt at inserting. Thank you.